Do you wonder the type of nursing school you would like to enroll? Are you thinking of joining the nursing profession, and you're wondering if you go through College of Nursing, School of Nursing, or apply for nursing in the university? You're wondering the one that is more faster, the one that is best for you. So if you find yourself in this type of situation where you're thinking of the right path to go through becoming a nurse, then this video is for you. So in this video, I'll be discussing the difference in going through School of Nursing, going through College of Nursing, or going through the university to study nursing. So if this is what you're interested in, then stick with me to the end of this video. Like this video, share it with somebody who this video will benefit, and don't forget to subscribe to my YouTube channel. So my name is Nurse Valerie Chimeze Ogaram. I'm a registered nurse midwife and a certified family planning care provider. In this channel, I talk about pregnancy, labor, delivery, maternal and child health tips, family planning, reproductive health, and everything about nursing and midwifery in general. So today, I'll be discussing about your career path in nursing, the right school for you or the right college for you. I will also be telling you the path that I went through and the best for you. So start with the School of Nursing. School of Nursing, most schools of nursing last for 3 years. So when you go to School of Nursing, first of all, you apply, you go through the entrance level. You after the entrance level is the exam. When you apply, you'll be called for an exam. When you pass the exam, you go for interview. When you pass the interview, then you start up the school. Excuse me. So when you start, you're going to stay, let me call it 6 months probation period, or we call it PTS. There's a preliminary test that you must take. Everybody takes that test in School of Nursing. You must take that test. So that test is after 6 months that you take that test. So after 6 months, when you take that test and you pass the test, you will then continue. But before then, you are considered as a temporary student, because if you fail the test, you're going to leave the school. You will exit the nursing profession. You will leave the school. You are not considered as a permanent student, or you're not considered as a real student. Let me use that word, because when you fail the exam, you are leaving. So during that period, you're going to be taking the preliminary test. You need to work hard, you need to study hard, you need to read hard, you need to take your studies seriously, because before then you must have paid your school fees, you must have paid all the necessary fees that you need to pay, hostel fee and all that. And it used to hurt after paying all that, and maybe you couldn't meet up with the number of subjects, because there are specific number of subjects that you're supposed to pass before you will continue with the nursing school. So if you didn't pass, maybe if you're writing 10 courses, and you're expected to pass 6 or 7 out of those 10 courses, then you failed 6 or 7, definitely you're leaving. So most times they may consider those that maybe failed 3 courses or 4 courses minimum. No, 4 courses maximum. So if you fail those courses, they will ask you to maybe resit it, and or if you resit it and pass, you continue. They used to give them chance. Most of the time, when they resit it and fail, they might ask them. It depends on the school, it depends on the college. Might ask them to go. So in School of Nursing, it lasts for 3 years for basic nursing, general nursing. It lasts for 3 years. So going through School of Nursing, after 3 years, you write your nursing council exam. But before then, you write your hospital finals, because that your hospital finals, pre-council, some school call it pre-council. That your pre-council determine if you're going to write the council exam. The council exam is the exam that will make you to be registered. If you pass the exam, you'll be registered as a registered nurse, and you will be given license maybe 1 year after you must have passed that council exam. So that council exam, so many students, you need to read very well. You need to, you put a lot of hard work to make sure that you pass that council exam. But before you pass the council exam, you must pass the hospital final or the pre-council, because most times if you don't pass, if you are unable to pass the pre-council or the hospital final exam, you will be made to step down and join the next class, which is like 6 months step down before you could be allowed to write another council exam. They do it like this, excuse me, because after 3 attempts in council exam, I don't think that these have changed. Most times they withdraw. They will withdraw you from the program. So that's why before you write the council exam, they make sure that you are well prepared. And most times, the school that you go through, if you study very well, you will write the council exam once and you'll pass. So for the School of Nursing, it's only 3 years. It's only 3 years. School of Nursing, that's general nursing, it's only 3 years. Then talking about School of Nursing, you can also go to School of Midwifery. Yes, there's another one, School of Midwifery. Many people don't know about it. They will ask you, School of Midwifery? Yes. And that one too is 3 years. It's called School of Basic Midwifery. Do you understand? You go through this School of Basic Midwifery, which is 3 years. And this school prepares you as a basic midwife. You become a midwife. After going through this school of basic midwifery, you become a midwife, a basic midwife. So now, most people will be asking, if after going through this school of basic midwifery, will I still go for nursing? Yes, you will still go for nursing. You have to still do your general nursing, because remember, midwifery is a specialty in nursing. So after your basic midwifery, you will still go for your general nursing, but it will not be 3 years again. It will now be a year and 6 months. So now, what I'm trying to say is that if you go to School of Basic Midwifery for 3 years, because the course program is 3 years, then you will now, after when you graduate, you will now go for School of post basic. They now call it post basic nursing. You now go for post basic nursing, which is a year and 6 months. So instead of going back to School of Nursing to do nursing for 3 years, no. If you have the basic midwifery, if you go through School of Basic Midwifery for 3 years, then your general nursing will be a year and 6 months. Because in your first year in general nursing, in your first year in basic midwifery, that first year, most things they teach is mostly about nursing. Sorry, it's mostly about nursing. So during that first year, then the second year and the third year is purely midwifery. Do you understand? So that is all about midwifery. I think they have also School of Psychiatric Nursing, where you can also do psychiatric nursing for 3 years. I don't know if that school is still on, but I when I was in school, I think I had about School of Psychiatric Nursing, basic psychiatric nursing, where you can do psychiatric nursing for 3 years, then go for post basic nursing for 1.5 years. That's a year and 6 months. So that is it. So if you're thinking of, okay, I just want to go to School of Nursing, get the certificate immediately, maybe travel abroad. You want to travel abroad, and maybe you don't want to go to the university, because in Nigeria, BNSC nursing is 5 years. So if you want to go to nursing, if you want to go through the university, you have to go. You just have to bear in mind that it's 5 years. Though I know that I learned that some countries is 4 years, some country they offer nursing for 4 years in their various university, but in Nigeria is 5 years. So if you're the type that is planning to travel, or you've done your BNSC elsewhere and you just want to obtain that registered nurse certificate, then maybe going through School of Nursing that you study for 3 years might be the best for you. But if you're the type that you're a young girl that just finished your secondary school, you want to further your education in nursing, it's best that you go for your BNSC nursing, go to the university, because that 5 years period will always help you. Because now the thing that is in vogue now is that you must have your BNSC certificate, and every nurse that did their general nursing in School of Nursing, College of Nursing is now encouraged to upgrade to their BNSC level, or get their BNSC certificate. So if you're a young person that you want to join this nursing profession, I will advise you to go to the university, write your jam, get the required score, and go through the university. It will save you a lot of stress, it will save you a lot of time, it will save you a lot of energy, because most times after going through the nursing school, and you now go and do your post basic midwifery, you now do it for like a year and 6 months, or you do another specialty, because apart from midwifery that is a year and 6 months, most specialty in nursing is 1 year. Most specialty in nursing is 1 year, except midwifery that is a year and 6 months. So now, when you finish your general nursing, which is 3 years, you now go for midwifery, year and 6 months, or go for any other specialty in nursing that is a year and six, that is 1 year, that's making it 4 years. Then you discover that you will also be mandated to go and do your BNSC. And most schools is 3 years in Nigeria, especially in ODL, online learning, distance learning. You discover that it's 3 years, some is 4 years. So when you must have spent 4 years studying nursing and maybe midwifery or any other specialty in nursing, then you now have to spend another 4 years. Although these 4 years now will be on the basis of online or open distance education, but it's still the same time that you're going to spend. You still pay school fees, you still study very hard, you still write the exam. So the best thing I used to advise young and upcoming nurses is to go through the university, go there, obtain your BNSC nursing, because within that 5 years, you will not just be a registered nurse, you will also uh, you know write exam either in midwifery or public health or any other specialty in nursing. So it's an added advantage. So instead of going through School of Nursing and doing your specialty, coming back to the university and all that, spending almost like 8 years, 7 years, 9 years, is it not better you just go through? You may, some people is pressure because jam, maybe you wrote jam and you couldn't get the required score, or your aptitude test and all that. Then you now say, okay, let me just go through School of Nursing. But I still think that even if you didn't get JAMB, it's still better the next year, study very well, write your JAM, get the required score, and go to the university than going through School of Nursing, spending that much time. So the whole thing now is, if you maybe you read a microbiology or any other course and you now want to do nursing, do you understand? Because now you are a graduate in another field, and you now want to choose the path of going through, you want to be a nurse, let me just say you want to be a nurse. Okay, you can now go through School of Nursing because that one is shorter, then obtain your registered nurse certificate, and that's all. But if you are a fresher, a young girl who wants to join the nursing profession, I will always advise you to go through the university, do your BNSC nursing for 5 years, obtain your registered nurse midwife, your public health or your midwifery, then you can then, continue with your master's, PhD, or any other you know, course or any other, specialty in nursing you want to do. So that's about School of Nursing. I hope this will help somebody who is, wishing or who wants to be a nurse and, thinking of the right path or the right channel or the right school to join. I hope this video helps you out. So please don't forget to like this video. It will help somebody. When you like it, YouTube will push it more for more people to see it and it will help them. So share it with your friends, share it with somebody. It might benefit. Then don't forget to subscribe to my YouTube channel. Most times, these are the things I talk about on this channel. My name is Nurse Valerie. Thank you for listening. Bye.